You all know that about 3 weeks ago, we brought in a virologist to help set up the lab, and with him and what he did, we are now able to test for coronavirus ourselves, for coronavirus disease ourselves. But that was just a start. So to complement that, we've brought in some surgical gowns, some gloves, surgical masks, both the surgical mask and then the N95. And then we also brought some testing kits and some screening kits, which we delivered to the country 2 days ago. And that should serve us, for a while, assuming we don't get a massive jump as Trinidad has at the moment. There is a case of a Cuban who went back to Cuba and was tested, who left Guyana to Cuba, was tested and was positive. Now, by convention, that case will belong to Cuba, to be counted by Cuba as an imported case, just like we had a case from the US. So that's not our case. So we still have 5 cases, 1 death and 4 living. Now, the denial by the positive cases, I'm not surprised. Why am I not surprised? Because now there's a lot of stigma attached to coronavirus disease. So if you are deemed to have coronavirus, you cannot even cough, you cannot snore, you cannot do anything. Nobody wants you to be near you, and rightly so. So because of that, people are going underground. That's one. 2, I think the other reason is the denial is, no, I don't trust that possibly the positive case is in fact really positive. And we saw that also with HIV. When we had HIV tests tests done, persons, once you give them well, it's not me. And what normal people would do is they'll go to another state, another district, test again. And then when it's positive, then they realize, oh, well, I might as well accept it and move on. So it's a phase that people go through, and I'm not surprised. What is bothersome is when people are in denial, what happens is they then go on as if business is as usual, and that is worrisome. That, I think, in my mind, even sometimes I'll even categorize it as recklessness, and also putting other people in danger. I think that is a quantum leap, but from the way things are going, I think we are getting there. I think we should seriously consider a lockdown. China had a province of 50 million people. It's only because they locked down the whole society they were able to have the disease go up, stay up, and started falling, to a point that now there are more cases outside of China than in China. It's because of the measures that they took. And most of the measures are lockdown, social distancing, physical distancing, and I think we need to do that. Otherwise, it's going to be difficult. I think we have churches, we have mosques, the religious organizations, mosques, temples, churches. All of that, I think we need to be very careful. Even markets have to be in such a way that we can have that physical distancing, and that has to be well programmed. If it means having somebody who will determine who sells at the market on a particular day with some distance. If we don't do complete lockdown at some point, I think we are going to be in deep trouble. Deep trouble. Now, if we have 1,400 cases, 10% of them will be critical. 20% of them are likely to be serious. That means we are thinking about 30%. That means we are looking at about 450 people in hospitals. Now, where can we have those 450 people? Some of them may need respirators, some of them may need other things that may not necessarily be there. I think we need to take this seriously. People at the weekend were meeting in various places for various reasons. I think if we don't take care, we'll be enjoying ourselves, but then at the end of it, we'll start counting bodies. And that's not what we want. We should learn from Italy. We should learn from Italy. They have regretted the low start and the fact that they didn't lock down early. Now, you have whole coffins lined up in churches, no family. Someone just comes to pray and they take the coffins away. Is that what we want? And the answer is no. I think we need to take it very seriously. This deals with our existence as Guyanese or people living in Guyana. I think we do not want the possibility of reaching this new modeling that just came out 2 days ago from George Washington University. This medical analyst is saying that in most countries, 40 to 80% of their people may be affected if they don't take measures. And coronavirus disease is not going to think about whether we have a political impasse or not. No. You are going to be attacked and you are going to die. If anyone thinks, well, I'm a young person, I cannot die, they say it only affects the elderly. Trust me, you will get it. You may not die. You will take it home, and your parents will die because they may have comorbidities, and you are sending it home. That's one. The other frightening thing is New York study that has just been done. 4,000 people. They found out that even with young people, 15 to 45. They constituted 12 to 13% of the person who had to be put in hospital. That means that you could be young, you will still end up in hospital. And if you end up in hospital, only God knows anything could happen. I think we need to take it seriously. I mean, politics or no politics, we have to take it seriously. This is health, and this is our lives. But I've received calls from pet owners saying that people are telling us we should euthanize our pets. No. To date, we do not have evidence of spread between pets and owners. And therefore, persons who have pets, please love them. You are not going to be put at risk. What is going to put ourselves at risk are the persons who still go out at night and party, those who have communal groupings and have day parties and day barbecues. Those are the ones that are going to be putting us at risk, not our pets.